So I just basically wanted to share the procedures that go along with this and try to get my ugly face out of your way. But when you make your appointment, I would make one early because if they have to go in there and repeat the procedure, it takes about 30 to 45 minutes for it to be under a microscope once the procedure's done. Then they come back to you and they let you know if it's clear or not. Sometimes they will have to go back and take off a little more, which means another 45 minutes waiting for it to be under the microscope and freeze it and everything they have to do. So, in the information they give you for post op, pre op, it says to eat lightly. It's okay to eat lightly, but skip that, eat well, because if you go in there and you go all day without food and you just eat lightly like I did, I went through horrors with getting nauseous from not eating, if you can imagine, and then having to wait for these procedures to be done. I was lucky. They only came back once. So I had 2 rounds of the procedure being done. And so I would definitely eat well. And they asked me, when I was feeling nauseous, did you eat? And I said, yeah, I had like really lightly. I had celery stuffed with pimento cheese. I had several stalks of it. And I thought, well, this will get me through until, and then afterwards, I'll just eat really well, a bunch. And, but I just didn't have any food in me and it was making me sick. And plus, it was so cold in there, it was like being in a meat locker. So, eat well because you're not going to get sick from eating. They don't put you under. So there's nothing like that going on. All they did was do a local on my face. It's like going to the dentist, when they're going to deaden you. Well, they just deadened my face. It didn't hurt. It was just a little stick. So that part wasn't bad at all. So basically, that's it. It's just the problem is if they have to go back and repeat the procedure, you're just in there for a longer time. And it was really, I felt so sorry. My doctor was telling me he had a patient down the hall that he was really working on, and he really needed some time on sewing my face up because it got so close to the eye. And he was saying he kept having to go back and repeat the procedure on the gentleman. It was on his ear. And he said that they had to remove so many pieces off his ear. They were trying to rebuild it. So